And a very warm welcome back to the studios. Now, Humanity First is an international charity that provides disaster relief and long-term development assistance to vulnerable communities in 52 countries across 6 continents. The organisation is run by volunteers with diverse skill sets across the world and has access to thousands of volunteers worldwide. Now, Hazrat Khalifatul Masih V, Ayyadahullah Ta'ala binasrihil Aziz, has mentioned the countless services that HF has provided across the world, especially in relation to disaster relief. During the recent COVID-19 pandemic, efforts were made by HF across the world to provide humanitarian services in these difficult times. We have with us today representatives from HF in the studio. Fazal Ahmed Sahib is on my left, who is the Director for Operations HF Global. Fazal Ahmed Sahib is with us here, and we also have Aslam Daud Sahib, who is the Chairman for Humanity First Canada. Thank you both for joining us. Fazal Sahib, Humanity First has a lot of operations, a lot of works, but especially during this COVID-19 pandemic. What's HF been doing?
So Humanity First, alhamdulillah, is working on all 6 continents towards COVID. So we started as we were starting to see cases in February, and we started off providing emergency food, and actually we've provided over 10 million meals, and Canada and USA have been 2 of the at the forefront of that. But we were also looking at precautions, so we were providing face masks, we've been making and distributing hand sanitizer, and then many new countries come on board like South Africa. We've had to train them from a distance because we can't go there, but they've already started doing amazing work. So we're working in 75 countries, alhamdulillah.
And Aslam Daud Sahib, what about Canada? What's been happening during the pandemic in Canada? What kind of relief efforts have been in action over there?
Yeah, since the start of the pandemic, we have seen a surge of demand of all sorts of help from general public. We have a flagship project in Canada, our food bank, which was already serving throughout the year. But since the pandemic started in March, we saw a surge in demand. The clientele really doubled over there, and we have been serving food to our clients of the food bank, distributing food around various cities. Just in Canada, we have served over 2 million meals to people. In addition to that, we have been helping people with telemedicine services, where people can call us and we will provide them health services like prescriptions, medical advice, and also if they need to be referred to a hospital, we would do that. Other than that, we have been helping various communities. We were reached out by Iranian community for their special food needs for their seniors, and we prepared special food hampers for them, and we continue to provide them for weeks. In addition to that, we have been supporting the Canadian hospitals, especially in Ontario, by providing them over 50,000 personal protective equipment. This is in addition to the masks and sanitizers that we have been distributing. We have been offering the senior citizen and physically challenged people, single moms who are stay home and cannot come out, to call us, and we will deliver food, prescription, and anything else they need to their homes. This home delivery service has been in the forefront of providing services to people in Canada. In addition to that, we have been supporting 12 countries in Africa and South America. And particularly, I would like to mention in Nigeria, we started using our vocational training center to produce face masks. And these face masks are being distributed to general public to protect themselves and protect others. We have been distributing food in those countries, and overall globally, the Humanity First has already served 10 million meals to different people, in addition to distributing PPEs, face masks, and other sanitizers.
Sounds like great work. Fazal Sahib, I know that the pandemic has only been a recent event, and your work has been stretched for many years, and particularly over the last 12 months, a lot has been done in the area of healthcare. Can you give us an update of what kind of projects are underway at the moment?
So in healthcare, we've had a global health program for many, many years. We have 8 hospital and clinic facilities running. We now have 2 mobile surgery units, and in fact a 3rd unit has just been constructed in Germany and is about to be sent out jointly between UK and Germany, and is about to be sent out to Gambia. We have hospitals, our Guatemala hospital, we have a hospital in Senegal, in Mali, in Benin, we have clinics in Nigeria, we have a hospital clinic in Indonesia. So all of these are doing great work. But apart from that, we're also training. In low-income regions, you find the proportion of trained nurses, midwives, doctors to the population is low. So we're taking expertise from Europe and North America and building up the capacity in those countries.
Samdal Sab, I understand similarly on behalf of Canada, there's been a collaboration with the WHO in the Bahamas. Can you tell us a little bit more about this?
Yes, by the grace of Allah, Humanity First is now a partner with WHO. We are called EMT1 Fixed Team, which is Emergency Medical Team Fixed, where that is, we have a capacity of setting up a field hospital, and we can see over 100 patients a day. WHO has been partnering with us and has been asking us to deploy our teams in various countries. Last year, when the Hurricane Dorian hit Bahamas, they reached out to us and asked that Ministry of Health Bahamas has requested an EMT1 fixed team to help in various affected areas. And we immediately deployed a team consisting of doctors, nurses, paramedics, and firefighters to Bahamas, where they served for more than a month. And they also continue to serve after that in a smaller capacity to run a medical clinic over there, provide healthcare support, and also rebuilt the local facilities that was destroyed by the hurricane. So this has been an exemplary service by Humanity First, which was very much appreciated by WHO. And since this pandemic, the WHO has approached us a number of times to send teams in various COVID-affected countries. Unfortunately, we have not been able to deploy team just because of the travel restrictions and the need for quarantine, and WHO appreciates that. So they have asked us to be on standby to provide remote support. And we have been actively meeting with them on a regular basis. Next week, they are doing a virtual training where we will be running simulations to provide support if there is a second wave of pandemic. So we are proactively preparing ourselves, and with WHO, we are ready to respond both in South America and internationally, anywhere in the world.
Faisal Sab, it's nice to look at the bigger picture. But is there anything that you've seen over the last 12 months, any experience that any feedback from any person who's benefited, that's really moved you from the services that HF has rendered to people?
We all see stories like that. You've been to Africa yourself. So I was in Gambia last October. I was actually there for a peace conference and then working on Humanity First project. We went to Mansa Konko, it's a rural area, and there was a widow that we met. She had 10 children. She was struggling to survive. We'd helped her with an agriculture project. She had a whole field of rice. She was just about to harvest it. I said, how are you going to harvest it? She said, all the village will come and harvest for me. And she said, this will keep my children fed for a year. And this was from a small project we started for. That's just one example. Even through COVID in Guinea-Conakry and Guinea-Bissau, we're seeing examples where we're going through villages with food packs. And one lady we saw stirring a pot. And the guys asked her, you don't have anything in your pot? She said, my children are watching. I'm stirring until they go to sleep. And this reminds us of some of the old stories from Qadian as well. So we're seeing that, unfortunately, right now. They say that there's 820 million people suffering extreme hunger. And through COVID, the UN are saying it could go up by another 400, 500 million.
And this poverty is not just limited to those in the developing world, but also in the developed world, there are people that are suffering, and I know Humanity First.
In Africa now, in Ghana, for example, they were helping disabled organizations there. So this is part of the essence of Humanity First and goes back to the reason that Hazur started the charity and the spirit of the organization.
Samdal Sahib, you're in a country of extreme weathers. Canada has very hot summers and very cold winters. Have you been able to render help to the homeless there?
Yes, despite the fact that we live in first world country, you're right that people are suffering because of poverty in these countries also. And one of the biggest sufferers are people who are homeless. By the grace of Allah, Canada had the opportunity to help them in a number of ways. For a number of years, we have been running a program called Out of Cold, which is to pick up the homeless people, bring them to a safe shelter. We have been using Awan Ittahad, the facility provided by Jamaat, to host these homeless people on a cold night, where we would provide them fresh 3-course meal at night, opportunity to take shower, warm bed to sleep, in the morning breakfast, and a lunch bag when they leave in the morning. So this service has been being provided for many, many years now, and it's been appreciated by these homeless people who have nowhere to go in the winter. In addition to that, last year in 2019 winter, we added a new service called Shelter Bus. This Shelter Bus is equipped with 20 beds and a small dining lounge where we move the bus around in the city and pick up homeless people who are sitting in the street in the cold and ask them to come inside the bus, enjoy the warm bed, have a hot meal. We serve pizza and other food over there, and a cup of tea or coffee, and then once they have rested and warmed themselves, they can leave at their convenience, either after a few hours or in the morning, and we will drop them off, and the bus will return. So this service was very much appreciated. The demand is extremely high, and we are looking to see how we can expand this service if possible. It is an expensive service, but we have been running it throughout the winter and every cold night. We have also been helping homeless people by distributing food on a regular basis. Our university clubs, like York University Club, has taken a lead in going out on the streets and serving pizza, juices, and water to homeless people on a regular basis. In particularly during the holiday season, we go out and support shelters and people who are sitting on the street. In last couple of weeks, Humanity First has distributed over 500,000 of food to various shelters across Greater Toronto area. This has been very much appreciated by the organizers of this shelter, that this is the time where the demand is high, and this food, which included bread and fresh salads and some other items, which was given out to almost every shelter in this area.
Jazakumullah, thank you very much, Asandad Saab, for joining us. Fazla Saab, Jazakallah for your time as well. Just to wrap up, there are so many charities across the world. What differentiates, if you can just give us a very succinct idea of what differentiates Humanity First from other charitable organizations?
There's nothing that I could tell you that's better than what Hazur told us himself. So Hazur was guiding Humanity First and went back to the essence of Islam and of the Jamaat, and he talked about Hukuk-ullah and Hukuk-ul-Ibad. And the promised Messiah's guidance for Hukuk-ul-Ibad, serving the creatures of God, serving mankind, was it requires that a person's heart is consumed by a love for others, whereby he cares not for his own comforts, but rather he cares only for the comfort of others. It requires that a person is ever ready to personally absorb all forms of distress for the sake of others, and to consider the pain of others as though it is his own pain. So it is a privilege for us to serve in Humanity First, and all of us have that ethos that we're prepared to sacrifice for the wider community.
So it's that passion, the empathy, the prayers of those volunteers and Khalifatul Masih that really differentiates us, and the value that we give to those people who are the recipients. We hope and pray that all of them really and truly do profit from what we've actually given, which is actually that which is given from Allah the Almighty. So with that, we conclude this small program and go on to a break. Stay with us for this special broadcast. Jazakumullahu ahsan al-jaza.
أخبار الفجر